All right. So I just want to thank everybody, today for uh for joining us today on this massive AP in 2026, guys. This is kind of like the biggest um AP ever. So anyway, my name's Bill Feggins with Divine Assurance Group. I've been doing this for 20 years, and I have never seen this much market disruption ever in Medicare. Things are still coming out. And it's just incredible because it leads to masses opportunity. It's good for us, not good for the clients. And the way that they're doing this information to the clients is not by phone calls, it's by mail. A lot of them don't even check their mail. But they're going to check their annual notice of change that they get their ANOC and find out either A, they lost their plan, they're losing benefits, their plans have been cut down, and what is truly BCI. They don't absolutely know what that is. That you have to have chronic conditions now to even get food. Okay. So many cuts and changes have been happening right now that we need to stay up and on it because, again, you can lose your entire book of business or you can gain a new book of business times 10 this year coming up right now. And to get out there doing table events, grassroots, your current book of business and referrals, you're going to see a massive influx of new clients, and this is going to be if your biggest AEP ever, and if you're new, it's definitely and hanging around some veteran ages, it's definitely going to be you're going to write up a lot of business, especially if you writing final expense or any other thing like that. So good time to be in it now to own your book of business. Be with an FMO like Niche Lawson Fleming guys, where you're free and no one's LOAing you and holding your book of business. You guys got a lot of traps out there, and you could be working your butt off, spending all your sweat equity, losing, everything inside this Medicare game because it is a business, it is a game. You got to know the industry, and we're going to show you guys the ins and outs of what's happening out there, and what you also need to add to yourself and your portfolio. Again, hospital indemnity plans. We got to add that because you got to make money now during AEP and also final expense because you got to make money now by adding that. You got to learn how to combo. You have to. It's a necessity to combo. Okay. Everything, nothing is single dished anymore. If you guys order some fast food, do you order just the burger without the soda? So every you don't. You want to have something to drink with that. So I'm sure you're gonna add a combo. They know that. So everything needs to be comboed, this year going up because you're going to be meeting new people. So I say all of that because I want you guys to make sure we get contracting in order. If you don't have it, Chris is going to get into that. We get ourselves set up. We're going to have some training because once AEP hits, even I have to go out there and see clients as well, and flip books of business because things are changing and things are still going to come out too. It's going to be a lot of shockers coming out too, a lot of non-commissionable plans coming out, and they're going to do it right at the last second too. This is just what it is. They're going to do this. There's going to be some surprises, and you guys got to know this information because you can lose, but you also can gain with the information by being here. So, anyway, guys, enough of me ranting. Much appreciate you guys, and we're going to keep on doing this. And don't forget tomorrow, Tuesday, September 16th, to get to the well care kickoff in King of Prussia at 1 p.m. All right. So please be there. It's at Bahama Breeze at 1 p.m. I just want to make that announcement here on Zoom. Tomorrow, September 16th, 1 p.m. Guys, get there. Okay. I already registered all of Divine Insurance Group. Just show up. Okay. If you don't have if you're not contracted yet with WellCare, let's get it done today. Check your email. There's a contracting in there. Get that over to Chris and Zach right away and attend the meeting. All right, Chris. That's enough for me. Pass it on to you and Zach. Thanks, guys.
Perfect. Thank you, Bill, and thank you everybody for attending here today. Zach, Bill, somebody just give me a quick thumbs up if you're seeing my screen here and everything looks good. Perfect. All right, everybody. So again, thank you so much for taking the time out of your mornings to just be here with us on a Monday. I hope everyone had a good weekend. Obviously, we're here to talk about AAP, right? There's a lot of changes that are coming into the space here. It's funny. I know that Zach, Bill, and I were all sitting here pretty much in the same exact seats 12 months ago, saying it's going to get crazy. Hey, there's going to be a lot of disruption. Hey, we're entering into this anywhere between 2 to 4 year cycle where Medicare Advantage and Medicare overall is going to be going through a challenge in terms of benefit changes, service area reduction, all these different factors because you take in account the Inflation Reduction Act, the lower Medicare reimbursement rate increases, inflation, all and utilization is way up, everybody. And we'll go over that too. I'm not going to get too ahead of myself here, but today we're going to talk about where we're at in terms of the Medicare industry, where we're going to go, and how we're going to navigate through it. So, again, thank you, everybody. My name is Chris Holmes. I'm with Neishloss and Fleming. We work with Bill Feggins. I'm the Vice President of Sales. Today, I am joined by Zach. Zach, go ahead, please.
Thanks, Chris. Hey, nice to see everybody and really looking forward to 2026 AEP with all of you.
Perfect. And let's get it rolling. So what are we going to go over today? So here's our agenda. First, we're going to go over the 2026 Medicare State of the Union. I feel like I've already kind of thrown away like a quarter of my bag here by kind of talking about it, but we're going to go in through it in full. And then, after you hear about the State of the Union, you're probably going to wonder, well, how do I manage my book of business? We'll go over that. Then beyond that, well, how do I manage AEP? How do I take advantage of all this opportunity and make sure I retain all my clients? We'll go over that as well. Then beyond that, we're going to go over a new lead system that not new, but a new and improved lead system is probably the better way to say it, called Plan and Roll Leads. And also the Plan and Roll platform. We'll go over that. And then we'll go into technology. Technology is going to be your best friend, right? I understand that we might be doing in-person appointments. Some people still like to do paper applications, but if we're not utilizing technology in every part of our business, then we're losing out on time. And as we all know, you only get 7 weeks during AEP, which 7 weeks to somebody who doesn't understand the industry might seem like a while. But for somebody who has a few hundred people on their books or a goal of adding a few hundred people, not nearly enough time. So we'll go over that as well. And then, of course, Bill talked about it early with opportunities in terms of the cross-selling game, right? We're going to see benefit degradation. Benefits are going to certainly shift, which means there's going to be a need to add in some cross-selling opportunities to be able to give our clients the fullest set of protection from any sort of medical bills or liability. So we'll roll from there. And then, of course, we'll go over real briefly the carriers that if you don't have them with Bill today, you got to get it figured out, and we'll tell you how to do that. So let's go into the Medicare State of the Union. So this first one up here, you might just be like, huh, that seems like a lazy sentence here. 2025 equals 2026 AEP. Guys, it's pretty much it. We're seeing the same level of disruption, literally to the tune of however many service area reductions, benefit reductions, commissionable plans being or non-commissionable plans. So we're seeing a lot of that. And 2025 was the culmination of, like I said, the financial pressures that carriers were now starting to face, such as the Inflation Reduction Act. You're also seeing inflation, the Medicare Advantage reimbursement rate. For those of you who don't know what that is, every carrier that works with Medicare Advantage consumers gets a set amount of reimbursement from the government every single month. What that reimbursement is supposed to do for the carriers, help them afford to provide the care to the consumer. Now, typically, they always get a rate increase every year, which helps that amount that they get every month go up to be able to accommodate for inflation and other factors. Well, for 2 years, that increase rate really wasn't what we had seen previously. So that's created some financial pressures. All of this comes together to point to the carriers to say, well, if our margins are getting slimmer at the top, where can we look at the bottom and cut? And what that's going to be is service area reduction in places where those plans simply are not profitable, or plans that weren't designed correctly and are increasing in cost to the carrier as well. What this leads to is carriers making the decision to take plans out of market, makes the decision to make this plan maybe no longer attractive by maybe jacking up the benefits or taking out commissions. And I am seeing, I believe, some chat stuff coming through here. So, or there's just some thumbs up there, but I didn't say that earlier. So if you do have questions on anything that we're discussing today, or questions in general, feel free to put them in the chat or the Q&A box. Zach and I will get to it, and we'll run from there. And there will be time for questions at the end, hopefully, unless if I just continue to rant like I always do. So again, 2026 AEP is going to be different because now it's in our own backyard more than it's ever been before. The state of Pennsylvania is seeing service area reduction, unlike I've seen in my 9 years in this industry. We're seeing it in Philadelphia. We're also seeing it over in New Jersey. We're seeing it in Central PA, Northeast PA. We're seeing it in Western PA. There's a lot of opportunity for multiple different carriers that are terminating their service area within the state of Pennsylvania. Now, remember, if these consumers do not go into a new plan effective 1/1/2026, no coverage at all. Now, luckily, for those people who fall into that category, they will have a 60-day special election period at the beginning of the year to utilize during OEP to be able to select a new plan. But again, there's going to be a lot of people out there that need to talk to an agent. And it was a very interesting statistic. So last year, there was and I can't recall the exact number, and I tried finding it for today's meeting, and I really apologize, but I didn't. But there was somewhere between a 4 to a 14% increase in the people who ended up back on original Medicare at the beginning of 2025. Well, that's not because they just looked at the plans and said, you know, I'm not really happy with how this is going. I just want to go back to original Medicare. Who cares about Medicare supplements, Medicare Advantage? No, those people who fell back to original Medicare only fell back to original Medicare because they didn't have an agent talking to them. So that's the part of the opportunity that's out there. These are essentially free agents because you might talk to all of your consumers, but many agents that don't talk to all their consumers. They're looking for the first year revenue. They're looking for the person that they can go gain, not somebody to retain. So again, you have 1.5 to 2 million terms across the country, which is the same amount of numbers that we saw last year. Also, 80% of consumers will be receiving a negative annual notice of change in their benefits. 80%, 4 out of 5. That means that there's going to be most people who you talk to, and they're probably going to be on your book of business, are most likely going to be unhappy about one thing or another. Now, again, a $5 a $5 PCP copay going to 10 probably isn't going to absolutely destroy anybody. However, there's a lot of other benefits that are changing. Look at the OTC, look at the flex card, look at the dental, look at the vision, look at the hospitalization rates, the premiums, all this stuff. There's going to be a snowball effect of benefits that simply are going to be degrading comparative to where they were in 2025. Another thing that's going to be coming out here too, and you could probably already see it by looking at your first looks, HMOs and PPOs, the days of them being kind of similar in a benefit offering are going away. PPOs cost the carrier more and require much more of an administrative burden than what an HMO plan does. Now, right now, you go to pretty much any market. You'll say, I see the carrier offering a $0 HMO and a $0 PPO, and the benefits really aren't that different. Well, it's because consumers wanted PPOs. Consumers want to have that open network access. Consumers want to have flexibility that the HMO does not always provide. Well, that means that the carriers were making all the benefits so attractive on the PPO because that's where the market was dictating. Now the PPOs are going to be taking a step back again due to a financial reason because they cost the carriers more. So what you can expect moving forward is the carriers starting to build their plans, and we're seeing this with IBC. If you looked at what they're doing with their 2026 product, the PPOs are kind of being, no, I wouldn't say pushed to the side, but the HMOs are going to be put on a pedestal or trying to push people into it because it makes more sense from a carrier perspective. So again, HMOs and PPOs are not always going to be this equal kind of benefit package that you've seen. You're going to see PPOs cost more, or if you're going to see a $0 PPO, It's not going to be it's not going to be a competitive benefit. So with these four kind of line items up at the top, um, all this stuff comes together. And another thing that I didn't mention either is utilization across the Medicare industry. Medicare supplement, Medicare Advantage, original Medicare is way up. It's called the COVID catch up, everybody. And I'm not talking about the condiment here. So, what happened during COVID is that everybody was told to bypass their elective surgeries. Don't go to the specialist for this unless it's completely necessary. Don't get that knee or that hip done or whatever it is, or name whatever service that or procedure that isn't exactly a necessity, but it's more of an elective surgery. Well, in the past 2 years, after the world has been opened up for a while, we are seeing that the utilization is going way, way up, and the carrier simply did not account for it. Utilization is probably up to one of the highest rates it's ever actually been. And the more you use that plan as a consumer, the more it costs the carrier. So there's so many different factors in there, but those are the 4 to 5 top factors that are going to create disturbance, if you want to call it, throughout AEP. And all this leads to the fact that you absolutely must be on top of your portfolio. Whenever I say your portfolio, I am referring to the carriers you are licensed and ready to sell and being able to represent to your consumers. Because just because you always sold Cigna in previous years, or IBC or Aetna, what if those were your big three? They very well may not be the big three this year. You might look at a benefit structure and say, boy, oh boy, this seems great. But guess what? That benefit structure may not look as great once you run your first Part D quote for 2026. Make sure that you look at your product and you look at what's going on around you in terms of your market and make sure you have everything that you need. Excuse me, and we'll be going over there later as well. Plan enrollment management. I had no idea how to really put this bullet point down here. And I still kind of, when I read that, I'm like, what the hell was I talking about here? But here's what I am talking about. You will see plans go non-commissionable just like you did last year. I will bet on that. There's going to be plans, and the carriers are getting ahead of it now. I think that they are doing the right thing and saying, hey, this plan is not commissionable, this plan is not commissionable. At least we're getting a more of a heads up than what we did with Cigna last year and been other carriers too. But what I mean by this is, and we see it here a lot, especially in Pittsburgh, because typically there's one plan everybody loves and they'll flood people to them at a 60 to 40% ratio. So what I mean by this is be careful with who you're enrolling in what plans. And this is not only just a carrier message, this is more of an industry message. And what I mean by that is if I have one plan in my market that is above and beyond the best benefits there are, blah, 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 I am probably going to want to enroll everybody into that, right? And what I mean by that is I'm probably eventually going to get tunnel vision and say, I know this plan accepts UPenn. I know this plan has this drug at this tier, or anything like that. You know, it just might become your default and you're moving so fast, you're just going to try to present that product and that product only. We need to present all products that make sense for the consumer. But how many of the people who we put in that plan should probably be in a chronic cares plan? How many people in that plan? Sure, maybe the $0 HMO is a good fit, but does that really fit all of their needs? Is there anything that I can look at in terms of a plan and say, hey, you know what? Wow, this plan is really, really good for everybody. Here's the segment of that population that's probably better served on a plan that you may not be thinking about, but would work for them. And again, chronic care is going to come really, really big into this. But this whole thing is right here is when you not force everybody, but when you push the whole line in the one boat, eventually that boat can't take on anything else, and it's gonna sink, which means non-commissionable announcements come out from the carriers. So just something to look at there. Keep an open mind. Not all consumers are good on one plan, because they're most likely going to have different needs, than their brothers and sisters or their neighbors, however it goes. Lastly, SSBCI. I am sure that everyone is tired of hearing about this, and I'm going to hold on. I'm supplemental security benefits for the chronically ill. I don't know. I think that I got 4 out of 5 on that. I want to say I got 4 out of 5. But what SSBCI, Bill, I'm getting a thumbs up. I think I got it. So what SSBCI is essentially a process that is being put in place for the carriers and CMS and everybody to help curb spending on all these additional benefits, and trying to limit them to people who only fall into chronic conditions. And what these benefits are more specifically going to be the healthy foods allowance, certain OTC allowances as well. So basically, what this is, and every carrier, and here's what you have to know, every carrier is going to use SSBCI processes differently. Now, most of them are going to be looking at past claims from that consumer, and then through there being able to determine whether or not they have a chronic condition that falls into the category of what the plan will cover and provide the additional benefits for. So keep that in mind, especially your D-SNP consumers, especially your C-SNP consumers, especially your traditional Medicare Advantage consumers, where there would be a healthy foods allowance or an OTC allowance available to somebody who has a chronic condition on that plan. That's something that the carrier should be able to handle. However, I encourage all of you, as you're going to the rollouts, as you're preparing for the products, as you're taking the certifications for 2026, stay on top of it, because otherwise, if you don't pay attention to it, you end up causing a lot of confusion for your clients. And we expect that we are going to be seeing a lot of noise at the beginning of the year when consumers are trying to use their benefits. But guess what? They haven't been activated because their chronic conditions have not been verified yet. So that's what I have on my State of the Union here. We'll be going over some more stuff. Zach, is there any questions or anything that we need to address at this moment?
No, not as it stands right now, Chris. I'd say keep going.
Fantastic. And here we are. We are off, baby. All right, book of business management. So here's something where this isn't really groundbreaking stuff here, but I think that it always helps when we talk about it from an overall perspective. So, hey, I have 100, let's just go over the example. I have 100 clients on my book of business. I'm going to be facing some disruption within my book of business. I want to make sure I retain my book of business and help them first, and then I can focus on new business. So how do I, as the agent, prioritize my book of business? I'm looking for 2 things here. First, who's going to have a plan at the beginning of the year? Who isn't going to have a plan at the beginning of the year? Those are your number one people to talk to, because guess what? If somebody calls your consumer and they say, hey, you're on this plan, or the consumer tells them what plan they're on, hey, you know that plan is not going to be available in the next 3 months, right? Like, you're not going to have coverage at all. How many of your people are immediately hanging up and calling you? I'm sure you have quite a few of those consumers there, but I guarantee there's people in your book of business that as soon as they hear for the first time that that plan is just not going to be available at all, they're probably going to be more likely to listen to the person who's educating them on this than you who hadn't yet. So look at your plan terms first. Next, whose plan is going what I like to call sideways? Who is just going off the rails here? They've been happy with this plan for a while. Now, all of a sudden, the benefits that really attracted them to that plan is no longer available, or they're no longer as attractive as they used to be. I am then also prioritizing them. And what I would consider here is, I like to use a scale, and you know what, this is recently adopted from a carrier that we work with. I'm not going to pretend that I came up with this, but I call it the 1 to 4 scale because they call it the 1 to 4 scale. But one indicates my most needy people, and that's going to be my plan terms, right? They need a plan. They are absolutely the first people who I need to talk to. And then number 2 is going to be my benefit reductions. Whose plans go sideways? Whose plans do I know I'm going to need to talk to about other options because they are not going to be happy with this? Those are your 1s and 2s. So the lower the number, the most important on the priority list. 3 and 4. 3 is going to be kind of a mixture. 3 is going to say, hey, this plan still pretty solid. Took a little bit of a step back, but still serviceable. Didn't lose a network provider. Didn't lose this. Everything's fine. But I should still probably talk to my consumers about it. Those are who fall in three. And then number four is people who are not really impacted at all, but maybe just need a review. So what we have been doing is looking at books of businesses, looking at our own books of business as a carrier, I mean, as a FMO, and identifying one through four who needs the most attention, all the way down to who just needs a touch to make sure that they're good this AEP. So prioritize that, attack your number one priority, folks, first, then go to second, then go to three, then go to four. Um, and if you prioritize it there, it's going to make it a lot easier to work over time. Technology. Again, we talked about it earlier. If we are not using technology in a time where we only have 7 weeks to basically save the world of Medicare, is what I like to call it, then we are doing ourselves a disservice. If you're not using the technology, you will be left behind, probably, right? At least in terms of gaining new business. So, all right, you guys are all gonna probably throw tomatoes at me if we were in person here, but Medicare Center is not going to be Medicare Center anymore. We are moving to a new branding called Integrity Connect. Now, all the stuff you do with Medicare Center will still be there. It's going to be great. And matter of fact, we just had the Integrity Technology team in office on Thursday showing us what the future of this platform is going to look like. Guys, it's incredible. They actually estimate that for every month you use Medicare Center, gaining the CRM, gaining the production pooling, because there's going to be so many updates that come through here. We're going to have to do a whole demo on it. But all of the access to reporting, technology, and everything else that you get within Medicare Center is estimated to save you $2,500 a month as an individual that you would typically have to go out and buy this system, this system, this system. But more to come on that. Integrity Connect. Whoa, whoa, there we go. Integrity Connect. It's going to be where you do your enrollments. It's where your CRM is. You can do great things such as client intake forms, such as Retire Flow. If you're not familiar with Retire Flow, they are an incredible tool where it allows you to basically have a whole site for yourself where you can create a landing page. And it's a QR code that you can send out to your consumers. They create a profile for you. And moving forward, brand new right now, this system integrates to your Medicare Center profile. So if you have a Retire Flow account, and I did not do it justice there, just like I'm not going to be able to do Client Sync justice because we only have so much time, but they are great tools that help take hours and hours and hours off of your AEP because you're not chasing down your consumers trying to say, hey, what doctors are you seeing now? What drugs are you seeing now? Have you seen any changes throughout the year? You're having it all automatically loaded into a profile. So as soon as you go to that person's appointment, all you have to do is press start a quote, and it tells you right then and there what plans are going to be the best for them. These systems save you days of AEP. Make sure you're utilizing them. Client Sync's very similar as well. It's just in Medicare Center, directly housed in there. But I like to talk about both because we know a lot of agents use both of them. And I know a lot of agents have basically adopted Retire Flow, which is why now it's in Medicare Center. So I will then now go on to Plan Enroll. So Plan Enroll and Retire Flow have similar capabilities here. And the reason why I wanted to go over Plan Enroll is because Plan Enroll is a profile that every single one of you who are in Medicare Center already has. And I took a little bit of a screenshot here to kind of show you what it is. Yes, that's me, the handsome guy on the left. But oh, there we go. So this is a profile that is essentially built for you off of Medicare Center. Now, the About Me bio, I created all that. I wrote that out. But so what you can do here is you can take this link, which is in your Medicare Center account. You can take this link, copy it, post it out on Facebook, text it to your consumers, email it out, put it out on social media, however you want to do. You can market this page because this is your own personalized website. There are Medicare 101 assets on here. I'm just showing you the profile right now, but the website itself is pretty darn incredible. It has all the Medicare educational stuff. It has places where you can ask questions. It provides you that sense of validity to the consumer of whenever they're looking for you or they want to check out a website. It says, gosh, look how professional Chris is. He has this great website. It has all this educational content on it. I can actually not only, contact him right here by sending or calling, or sending an email, but I can shop plans directly from his site that are going to be tailored specifically to what your ready to sell permissions are in Medicare Center. And guess what? If they enroll off of it, which we still think that everybody should be talking to an agent before they enroll, if they enroll, that's it. That's a policy for you in your name because look at that MPN right there. It's all linked to your stuff. So at that point, it's a free enrollment platform. It's a great way to market yourself too. Um,
Hey, Chris, can I
yeah,
jump in
hang
here
on.
real quick? Go ahead and rest
Right.
your voice a little bit. So I'm getting some questions about, Integrity Connect, formerly Medicare Center. So you guys heard us talk about Medicare Center for years. It's now going to be Integrity Connect. Two things. If you don't have a profile, guess what? It's free because you have a contract through Mr. Feggins here. And I dropped the link in there. So if you do not have a profile, click the link. It still does say Medicare Center. But what you'll do is hit get started, go ahead and register yourself. I'm getting some questions. Is this like Sunfire? The next one will come. Is this like Medicare app? So both of them are universal enrollment platforms. However, they're not integrities. So we have some of the best technology when it comes to Medicare in the entire industry. So what you guys are going to be seeing that you can do within the Integrity Connect profile will blow your minds. I know you guys have the WellCare visit tomorrow. But I am going to we are doing a webinar tomorrow from 2 to 3. If you're not going to that, I highly suggest you register and watch and see what you have capable. But essentially, you can collect your client data, run quotes, and actually enroll. So many people think that it's just a quoting tool or a CRM, then you got to go somewhere else to enroll. No, you can enroll right in Medicare or right in Integrity Connect. Okay. So if you don't have that, go ahead and register for it. One of the positives of enrolling in this system is you will see, yeah, Bill, I'll let you tap in here. You will see, everything in real time. So if you have an app that's not showing up and you reach out to Bill and Bill reaches out to us and says, "Hey, this app isn't showing up in my profile. I don't know if it's lost. I don't know where it is." If you tell us you took it in Integrity Connect, we can get an exact answer on that with in real time. If you took it in app or Sunfire, we don't have access to that to see that. Just wanted to make that clear. And then Bill, go ahead, come off mute.
No, thank you, Zach. I just want to ask that during October 15th, you guys could actually text your clients, your existing book of business, the clients that you know are pretty tech savvy. So if you're going to put them into well care, let's say dual plan, because you know that they're sitting on another product that reduced their benefits dramatically, or is playing games with SSBCI, okay? Because we're going to have that. And plus they need to be aligned more importantly than anything, then you should text them your link. So Zach, is there any recording on that? Would that be recorded? Would there be a link or access to that?
I'll have to check, but Chris, correct me if I'm wrong. As long as you register, I do believe you get the video recording
Okay.
For
S-
for the
for,
Medicare Center demo, right?
yeah, for the
Yeah,
Integrity
absolutely.
Connect.
So
Yeah.
you'll get it for the you'll get it for the one of the session that they just went over. Also, there's a lot of stuff that's directly on Medicare Center site as well through the Learning Center that has a lot of informative information. But we also can send out guides, everything. Regardless, I'll put it to you this way. If you can't make tomorrow, we know that you guys got another rollout to go to. We will make sure that anyone who is not in the know will be in the know prior till the first.
Cool.
okay.
I would say
Perfect.
proceed.
Awesome. So, not only, and there's going to be another technology, we're going to kind of go over a little deeper in the Medicare Center here. Integrity Connect. It's going to take me a while, forgive me. However, we do also have Lead Center and Plan and Roll Leads. Everybody here on the call has said it at one point, or, I know that Bill, Zach, myself, if you're an upline, you've heard it before. I need more leads. I need more leads. I need more leads. Just putting it out there, the issues, not the issues, but challenges have been really coming up in the lead generation space, especially from the one-to-one consent rules and the FCC regulations that are coming out about how we generate leads themselves. And not only that, too, when you're talking Medicare, we now have to add in all the other CMS requirements in terms of marketing, the approval needs, everything such as that. Long story short, guys, the lead generation world in Medicare has certainly been a little tougher. At this point, we are limited to essentially internet leads for Medicare supplements because we can no longer solicit inventoried leads for Medicare Advantage consumers. That is a big issue. So if I am a lead vendor and I am creating a lead list, a lead warehouse, Zach has to tell me he wants leads in that area before I can even generate them. So the turnaround time isn't what it used to be. The volume isn't what it used to be. However, we can still get instant ACA, life, and Medicare supplement leads right away off of Lead Center. And these leads go anywhere from $2 up to $10. Now, some of them are very old, some of them are going to be very new, but those are still leads that we could buy at a very, very low price. What I am very excited about, and again, when Integrity was in on Thursday with us, they went over plan and roll campaigns. Plan and rolls the link I just showed you. Not only is that going to be your site with your branding and everything, or plan and rolls branding, but Plan and Roll is going to be doing a national television and also a mailing campaign throughout all of AEP trying to generate leads. And they'll either generate mail-in leads, which will have to be instantly sold to somebody, or they will be doing live transfer leads. So they have two live transfer options. And there is a way that you can go in the Medicare Center, Integrity Connect, then go in the Lead Center. You can create a campaign and set hours of when you will be available for leads to be directed to you that are either instant transfers, as in the consumer calls, the line that they see on TV, and then they are automatically transferred to you, or you could buy vetted transfers as well, where it is confirmed that somebody is looking to talk about a Medicare policy, maybe instead of just calling about a scooter or, hey, where can I get this hearing aid or anything like that. So these are, oh my gosh, my mouse just went crazy. Where are we at here? There we go. These are great leads that we can go ahead and just buy. So if you are running into any issues at any time, and guys, these are going to be live transfers that we are anticipating to be around $40 to $45. Where else in this industry are you finding vetted leads for $45 that you know are for Medicare during the annual enrollment period? Very, very good system we have going on there. And from what we are seeing, there's been a great close rate on them as well, too, from a national perspective. So just something to keep in mind. If you have questions on Lead Center, first, I highly recommend you go in the Lead Center on your Medicare Center profile and then be able to go from it from there. And if you have questions, let us know. Technology, again, kind of going back to Medicare Center in general. We know it's the place for our multi-carrier enrollments. We know that we're looking up doctors, drugs, and pharmacies on there. We know it's an awesome CRM. But did you know that you could also do an automated marketing system as well, too? You can go ahead and set up texts, emails. Zach alluded to it earlier. But you can utilize this system as a marketing tool as well. You can send out birthday texts, birthday emails. You can send out reminders for your clients to sign a scope of appointment. You can send out reminders for people to create their client sync and plan enroll profiles. There's so many different things that you can do with this, and this is a system that's really being built upon as well. That will give you more capabilities within the system. I am not kidding when I tell you what we have just been shown and what is coming down the pipe for not only Nice Loss, but Bill and then you all as well is top tier. No other FMO or, I guess you could say marketing organization such as Integrity is going to be able to provide this. I promise you that. Eventually, and we're going to go over some times, I would anticipate by sometime mid AEP, you're going to see your book of business in Medicare Center if that contract is tied to Integrity. Now, also, which means it would be with Bill. So the more stuff you have with Bill, the more tracking and the more systems and eventually commissions will be in there. It's going to be a full view of your business. Now, again, business that was written outside of integrity or Bill, and then you brought that contract to Bill, that business that was written outside won't show in there. So only the more reason to do more business with Bill moving forward, so you can go ahead and track everything. But and we talked about it earlier. Trainings are housed in Learning Center on the Integrity Connect platform. They are also housed at nightloss.com, and they're also going to be housed through Integrity as well too. So there are trainings everywhere. If you cannot locate one, reach out to us. We'll get you hooked up with one. Cross-selling opportunities. Bill really talked about this earlier, which was a really good point, and definitely a big focus of not only the Philadelphia market, but many markets across the country. Right now, we're seeing the benefits just kind of go sideways, right? I swear, I was just looking at a market, and 3 years ago, there was $5,000 dental on most of the plans that were available. And now I think that I want to say it's like $1,500 dental between and vision combined. Like it's crazy to see how these benefits have just, really went down in terms of allowance and benefit amount. So it's going to be more important than ever. And you know what? I didn't even talk about DVH products on here because I think these are probably the most two important. But then, of course, DVH are great sales opportunities as well. But hospital indemnity even in Pittsburgh, where if you don't know what the Pittsburgh benefits look like and you compared them side by side with what Philly has, you would think that we have like a deal with the devil over here or something. Like we have like $300 per stays, $10 specialists, and that's on like a $20 premium. Like it's crazy. However, Pittsburgh's taken a step back this year. We're seeing less admission rates and more per day rates. Well, guess what? We're talking to all of our agents about the need for hospital indemnity plans, especially plans that have GI up to ages 79. We'll be talking about that in a second here, but you can GI these policies all the way up to like 79, some cases of 74, but nonetheless, hospital indemnity is a great product. And if you have questions on it, please don't hesitate to raise your hand. I'll be happy to go over, but it is exactly what it says right here. These are plans that are designed to help take the financial burden off of your consumers if they have a stay. If they have a stay in a hospital. Hold on, I did see a question come from Keith real quick. Does the hospital indemnity plan work when you have other hospital indemnity plans? If I'm reading that question correct, it's can I have two? Yeah, I mean you can if you want. You know what I mean? I don't know if there's necessarily a need for it, but you certainly can. And maybe you're looking at a scenario where you have a 5 day $200 per day benefit. Maybe what I would do, Keith, is I would look into seeing if it was possible for me to um, up that benefit with the current provider, or maybe just get a whole new plan in general and cancel the original one. There's a couple of ways. I don't see the need for two necessarily, because what I would rather do is say, well, yes, let's get you a new hospital indemnity plan, but hey, if you're willing to spend money for two hospital indemnity plans, why don't we up one of them? And then let's talk about what you're doing for your cancer diagnosis, right? A cancer diagnosis is also very important. And I think that where this really comes into play here, if you take the national maximum amount of pocket that's available on Medicare Advantage products, we're seeing those go up, 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 up. Well, one of the most costly things that can happen to a consumer is a cancer diagnosis. It's one of the worst things that can happen to a financial. Well, not only is it just a terrible day in general, right? Everybody on this call has had somebody who's gotten that call or that diagnosis from the doctor, right? Nobody wants to even live those days, let alone nobody wants to have to go through those days, let alone worry about how they're going to be able to afford care to give themselves the best chance of living well moving forward. Cancer policies are here, guys. They are something, A, they're affordable. B, they save they really help out when the time comes. So cancer policies, hospital indemnity policies, dental vision hearing products, these are going to be very, very important. And I know for a fact that we're seeing agents all over the country already lean into it. And guess what? This is not a AEP or a CMS specific product as well. You can push this whenever, And you also have way less restrictions in terms of how you sell it, what the 48-hour scope of appointment rule is on it, everything such as that. So focus on it. Make sure that you're talking to your consumers about it. You do not want to be the agent who didn't educate their client on ways that they can save themselves from financial burdens on days that clearly would not be great, whether they're in the hospital or getting that cancer diagnosis. Zach, any questions at all?
Go ahead, Bill. You can come off mute. Bill wants to say something.
Nope.
Exact. I just want to say on the integrity portal, you guys can quote on that too. So don't
Yeah.
think that the main thing that you're going to want to do in the home. Okay, we're going to have a lot of trainings too on the integrity portal this time. I'm gonna make sure in October we do. The reason is because if you just open up your tablet or your laptop, you guys, instead of saying, "Oh, I want to look at a binder," and then I do have one, AI will put it all together. But you could go in and you can quote and do comparisons, guys. You literally can do comparisons in real time. It just will save you. And then you can also enroll at the same time too, the Medicare Advantage plan. You can quote the hospital indemnity plan. You guys, you could do all of that on one platform. So if you know how to do it, it's going to save you time. You don't have to think, well, what plan should I put them in? It's right there. You'll know the premium, you know the benefits and everything. You can click a button, you can enroll them right there. So if you guys don't have too many hospital indemnity plans, we'll get those to you too. And it's in another email to make it easy for you guys. I have a couple carriers that we're using. We get all the way up to age 79 for hospital indemnity, cancer, all that, dental, vision, hearing guys plans too, because you want to add them. Again, you got to cross sell. You want to survive in Medicare. It's not like how it was back then with me. We'll get paid every week, doesn't matter when. That does not exist. Okay, so you guys got to do something, and you're really helping the client out too, because there are going to be so many gaps, okay, in coverage. I know you're like, no, my plan's going to stay the same. I just don't see plans staying the same. Right? What I've saw so far,
Right.
they're not. They're skimming back, guys. Major skimming back. Okay, and if a plan does look good, it probably is something in Part D. Okay, that's not good at all. All right. So anyway, back to Chris.
No, that's a great point by Bill too. So again, and I maybe I should put another sentence or two on this earlier because it is very, very important. So carriers will, and maybe I'm not going to say this like they're trying to be malicious about it, but carriers will hide faults at times where you just don't look. And that's going to be in the formulary sometimes, right? Oftentimes we're looking to make sure that our consumers' drugs are covered, but are we looking to see if that's covered under a tier that's 27%? Are we looking to see if that's covered under a deductible that applies through tiers 2 through 5, 1 through 5, 3 through 5? There's so many different things there, but just make sure you're looking at the Part D side of it, because that's ultimately where a lot of cost lies, right? And the carriers, believe it or not, they're on the hook for Part D pretty much regardless, anyways, right? The more and more they kind of get pushed into this corner by the Inflation Reduction Act. But so yeah, cross-selling is important. And again, I've been asked many times, what do I do with my consumers that are, most likely going to be enrolling in a plan that doesn't pay commission? Well, okay. I mean, that's not it's not ideal, right? Nobody's happy about it. If it's the best bit for the consumer, yes, I would refer them to where they need to go. But I am also going to talk to them about other products that are going to pay me commission. The hospital indemnity, the cancer, the DVH, all that wonderful stuff. Um, these times will pass. I promise you that. So just keep building your book of business with other products. Be willing to diversify. This, at the very end of the day, is another revenue stream for you that you're currently not taking advantage of. Um, Cross-selling, great. All right, contracts. Bill has a lot of contracts. We work with Bill on a lot of things and we love that. But I want to go over some contracts that I think are important for you just based upon the Philadelphia market and a little bit outside of it and going through there. Um, if you do not have these contracts currently with Bill, there's two routes here. If you have the contract and you are under a different upline outside of Bill, you can try to get a release. At this point, the transferring is going to be pretty darn difficult, right? We're pretty close to the windows. Most FMOs aren't going to be providing releases. But if you do have it, it's worth the try to bring it over to the bill so you can utilize all the systems that we discussed today and have more of a reach into the insight that all three of us share with you all. Beyond that, if you're just not contracted with them, get contracted with them. This is the year where you have no idea what your consumer's really going to need until you start doing the Part D quotes. And I promise you, there's nothing that us three on this call, Bill, Zach, and I, will dislike more than when you call us on 1010 and say, I have appointments next week. I need to get contracted with this carrier. It's just not going to happen in time for you. And we're all going to be frustrated because that means we're all missing out on sales and opportunity together, right? So review your portfolio, check to see what you have, and get the damn contract. Just hit us up. We'll be fine. But again, please, before you reach out to Bill or us, know where it's at, know what your current standing is with it, so that as soon as we all discuss what we need to do, we're going right then and there, as opposed to trying to do this scavenger hunt to see where your Aetna supplemental contract is. But that applies to these carriers. These are carriers that are going to be strong in the Philadelphia area. They're going to have strong cross-selling opportunity as well. And also you might see that third one down. That is HealthSpring, which is formerly Cigna HealthSpring. But make sure you have these products. You just have no idea where this is going to go. And this is what we've been encouraging agents all over the country to do. So that is the conclusion of everything that I had to discuss with you all today. We do have time for questions. I see that it is 10:56. I see that Zach and Bill, you guys have been kind of responding back and forth to the Q&A. But I would love to open this up if you do have questions, or if Bill or Zach, you have anything you want to add, please do first.
Yeah, I'm just gonna reiterate what I put in the chat. So I like to live better to have it and not need it than need it and not have it. If, to Chris's point, if you send any of the three of us a message saying you need HealthSpring, and you send that in November, the odds are HealthSpring's probably not going to come before AEP. It takes a lot longer during sales season to pick up a contract than it does right now. So look and see what you're going to battle with and what other we'll say what other tools you need to be successful.
Here's another good way to break that down, Zach. I really like that point there. If you're doing a supplemental and an ancillary carrier, that contract takes you 10 minutes to fill out. You submit it to us, we send it in, you get approved. Guess what? You don't got to touch it. If you never sell it, who cares? It's another tool in the belt that just doesn't get any sort of dings on it, right? You'll probably need it one day. Even if it's a Medicare Advantage or a PDP product. Okay, you take 10 minutes to fill out the contract, and then probably another 30 minutes to be able to do the certifications at some point. We're talking anywhere between 10 to 15 minutes up to 45 minutes total of your time to make sure that if your client needs that product in AEP, you can service them, you can gain that client, you can get the commissions off of that product as well. Don't let 45 minutes now scare you away from being able to have something that could potentially be the driver of your AEP. Again, this is all a dice roll. Whenever you go play roulette, whenever you go play craps, you don't know what it's going to land on. You just make your bet on it. Why not spread it across the table? There's nothing you can lose here aside from 45 minutes of your time. So that's my whole message on that. Not saying that your time is not valuable, but it's a pretty good hedge to have. But yeah, we're open for questions. Again, there will probably be more information that comes out. I wouldn't be surprised. The way that this whole 2026 has been 2025 going into 2026 has been going. We'll get off this call. There will be a major announcement from somebody somewhere in the carrier world, and then we're all going to have to get back together, but that's fine because we adapt, we pivot, and we move forward. That's what Medicare agents do, and that's what we've been doing for years. So that's what I got. Thank you, everybody, for your time. If there are questions, please let us know. Bill, if you have anything, please go ahead, my friend.
Yeah, real quick. I just want to say, first of all, thank you and Zach today for spending the time educating everyone on the State of the Union and what's coming about. Because yes, it could be some major surprises coming out between now and AEP. So I just want to, we're probably going to jump back on a Zoom if that happens, if something major happens in our area. Also, as far as contracting, check your emails, guys. I will send this recording to you. I already sent you the sample contract and also the onboarding contract form. You guys can email that directly over to Niche Loss, and we can get you guys contracted. The hospital indemnity plans are already in that contract form. You'll see Aetna Supplemental, Cigna, Mutual of Omaha. You guys can get that. That will have cancer plans and everything in there too. The reason why is because once you're contracted and you guys will log into your Integrity Connect portal, you will see your carriers that you're with in your back office. Okay. That will help you. You can quote with all of the companies on there as well. If you see something on there that you might want to do, just let me know. The point is that I'm going to be doing more trainings on the technology side for enrollment purposes and quoting purposes, because you guys want to get back to your current book of business. Okay. And you're going to let them know they're going to get letters in the mail in October. Okay. We might get some surprises, okay? Non-commissionable plans or pullouts, even worse, okay? Because they could do this. They might just do it. They might just completely pull out. Sometimes if they don't have the contract with the state to do Medicaid for their MCO, they might just pull out, okay? This happened in different states, like in Delaware. Delaware is a FIDE state. FIDE means we're forcing you, okay, to take these plans. So they pulled out United Healthcare, Cigna, and other care just completely pulled out, and they'll send you a letter to clients, an ANOC letter, and guess what? They don't read it or something like that. Next thing you know, they don't have a plan. Okay. So we're very important. Just know that as a broker, this time you are really in need. You are a special broker this time for people's health care. People's lives are on the lines, guys, now. Okay. Again, I told you guys so some of these insurance companies is profits over people. Okay. I said that. All right. And we're talking about our seniors and our loved ones. Okay. And right now, they have to qualify to get food, every one of them. And if you guys don't, because they're going to sit there like, oh, no, it's not me. Yes. Tomorrow, again, I want you guys to come to the WellCare meeting at 1 o'clock at Bahama Breeze and King of Prussia. It's going to be the #1 plan here in the Philly area, even in Delaware. Okay. For what we see so far. Okay. From today's date. All right. Things can change. But for right now, that's what we see. So let's get there tomorrow, guys. You're already registered. Let's get on some more of these trainings too with the Integrity Connect, so you guys can get you set up, get contracted with the hospital indemnity plans if need be right away. Whoever you're not contracted with, you saw on that list, go ahead and uh, print out and get that onboarding contract form and scan it, send it over to Niche Loss, to their contracting team. They will email you guys the contracts to get them set up. So this way you're in position. It's all about positioning right now, guys. You really only got 2 weeks to get positioned and get a lot of these certifications out the way. October come and we can have help, that can happen instantly in Medicare, but it can open up even more opportunities. Sometimes that type of disruption, it could happen just because it's political. So be in mind, catch up, check my emails when I'm sending them out, video emails, all types of stuff. Get your clients ready, print them out, get your Excel spreadsheet, get everything ready, because you're going to need to contact them and probably put them in the best plan so far and give them a heads up in October. Hey, this is the changes. We could talk about them. These are the things that are happening. And I'm afraid to tell you that, I don't know, based on your health, you might not have $200 in food moving forward. But here's a
Yeah.
solution. That's really what it is. So sorry. I just got to tell you guys, because this type of disruption right here is it can change lives. It can break lives. It can do a lot right now. Okay. It's wake up calls. Seriously. It's phone calls are for real. People's health are for real. So guys, just know that I'm making almost like a plead out here. Our seniors are already vulnerable to these changes. You got to get to them this AP. This is major. Yes, it is, Laura. It's major. So get to them. I just want to say that. I know we got to jump off, but Zach, Chris, thank you guys. If you guys say anything, I don't know if any questions come out. I know you guys are going to call me after this. Get contracting right now is #1. Certifications are #2. Get them over, guys, ASAP. Get in this office as soon as you can. We'll have supplies here, giveaways, everything. We're going to have more help than anyone here. We'll be talking to you guys. Get your technology in order, guys. Let's be prepared for AEP. Get your final expenses in order. Cross sell. Get it in order now, so this way you can thank us later. You guys are going to have the biggest opportunity to gain a new book than any other time. And that's all I got to say.
100%. Very well said. As Bill said, there's going to be a lot of difficult conversations this AEP. There's going to be some people impacted. Here's the thing too, and I can't believe we didn't discuss this at all. I do think it was briefly touched, and this will be the last thing I say. Um, where there's confusion means that people need you, right? And if you're helping somebody, remember, leave them a business card or two, maybe three extra. Ask them to give it to their friends that they talk to who are also in needing help. We talked about leads earlier and buying leads, but word of mouth, as we all know, is the best way to get more clients. Ask for referrals. People are going to be confused. There's so many consumers out there that you think there's going to be another agent like you tagged to them that are going to call them, give them the information they need, make sure that they're well aware of what's going on. But what about the probably, if I were to guess, 3 million people who are enrolled by a call center? They're not calling them, right? They need you. They need somebody who's local, an actual agent that's not there for the one-time transactional piece and says, see you later, don't talk to me ever again. They need an agent who's going to be by their side, a partner in their health insurance, not somebody trying to get 1 month of commission off of them and then go into the next. So that is that is what I got. Thank you again, everybody. Bill, thank you for getting your team together. Zach and I really appreciate the opportunity to be able to talk to you all. If there's anything that's needed, you know where to find us. Bill, thank you, everybody. Good luck this AEP and stay strong and keep pushing it. Thank you.
Bye, everyone.
Thank you, everybody.